Hello everybody, welcome back. Now, let's now discuss health insurance models, HMO, MCO, government insurance, and consumer-driven health plans. The objective of this course is to understand health maintenance organizations and models, list and describe types of managed care organizations, MCOs, list and describe type of government payers, explain and identify consumer-driven health plans, CDHPs. And lastly, we're going to discuss workers' compensation and liability insurance. Individual health plans. They are purchased by individuals for themselves or their families, not as part of a group plan. Patient Protection and Affordability Care Act. All individuals must have minimum essential coverage for themselves and their dependents. Healthcare marketplace or exchanges. Individual plans may no longer deny coverage due to a pre-existing condition. Yay! A person cannot be denied coverage, charged a higher premium, or denied treatment based on their health status. Now, let's talk about group health plans. They are offered by employers for employees. Purchasing power reduced rates. Employer pays all or a portion of the premium, may require member to pay a portion of their premiums. If offered by an employer, it must be offered to all employees eligible. A group health insured cannot deny coverage to an eligible employee or family member because of a pre-existing condition. Fully insured employer groups, small employer groups, self-funded, and associate groups. Advantages. Health plans. Directs coverage members to the provider, pays the provider directly for the services provided, sometimes provide higher reimbursement for the providers. The advantage is writes off the amounts over the usual and customary rates, collects payments directly from the insurance carrier. Non-participation disadvantages. For the health plan, it pays the patient, may limit the amount billed to the patient, for example, Medicare limiting charges, and for the provider, collects all payments from the patient. Now, let's talk about managed care organization, MCOs, health insurance, delivery of care, and the administration. The first plan we'll talk about is EPO, which stands for Exclusive Provider Organization. Of course, we discuss HMO, which is a health maintenance organization. IDS is an integrated delivery systems. PPOs, preferred provider organization, and triple option plans. Health maintenance models. Individual selects a primary care provider. PCP is a gatekeeper, meaning that referrals, authorizations, and all authorized inpatient procedures must be approved by the PCP. Services provided outside of the network are not covered, meaning this is non-covered services. EPOs, exclusive provider organizations, work similar to HMO, but here's the tricky part. An organization that has entered into contract with medical care providers or groups of the medical care. Providers to provide healthcare services to members. If member goes out of network, member is responsible for cost of the healthcare. Members choose a PCP. Members have a coinsurance and pay for a percentage of every medical bill up to the yearly maximum out of pocket. Integrated delivery systems. Network of affiliated facilities and providers that work together to offer joint healthcare services to members. Those models are PHOs for Physician Hospital Organization, MSOs for Management Service Organizations, GPWW are Group Plans Without Walls, and IPOs are Integrated Provider Organizations. My favorite, PPO, Preferred Provider Organization, allows members to choose the doctors and hospitals they want to visit from providers within network preferred providers. They must be in a network, guys, or you will be working on an out-of-network provider. Just FYI. Members are not required to choose a PCP. Out-of-network providers are reimbursed less, but it is offered, and the member is responsible for a higher percentage. Members typically responsible for a yearly deductible and co-insurance. Some services may require prior auth, but not all. Triple option plans allows an insurer to administer 3 different healthcare plans for selection by the member. Includes straight indemnity insurance, which is fee for service, health maintenance organization, HMO, and a preferred provider organization, PPO. Accountability Care Organization, Patients Protection and Affordable Care Act. Its shared savings program. Groups of providers of services and suppliers meet criteria, specified by the Secretary may work together to manage and coordinate care for Medicare fee-for-service beneficiaries through an accountability care organization. And ACOs that meet quality performance standards established by the Secretary of Eligibility to receive payments for shared savings. Made up of providers, networks of individual practices of ACO professionals. Partnerships or joint ventures arrangements between hospitals and ACO professionals, hospitals employing ACO professionals, and other providers and suppliers as determined by the Secretary of HHS. Government payers. Federal and state government payers include Medicare, Medicaid, and TRICARE. Medicare. Let's break it down. Part A are only for hospital claims or hospital insurance claims only. That's for Part A. Part B covers outpatient services. These medical insurance for things not covered by the hospital insurance part. Physician services, medical supplies, etc. Medicare Part C is called the Medicare Advantage Plan, which are private plans such as HMOs and PPOs that run through Medicare that must at least be equivalent to regular Part A and B services. So, in the Part C services, it covers A and B coverage in the Part C at a Medicare Advantage. And lastly, Part D is only covered for prescription drugs. So, to recap, Part A is for hospital only, Part B is for outpatient physician services and medical supplies. Part C has a Part A and B portion in that one plan, but it is covered under a HMO or PPO plan. And lastly, Part D is for prescription. It doesn't cover anything else but prescription drugs only. Medicare Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, and home health services. Part B, Medicare covers medically necessary services such as physician's visits, ambulance services, durable medical equipment, and mental health services. Part B has also greatly expanded coverage for preventative care. Now, here is the actual Medicare breakdown as of 2024. There's an inpatient deductible of $1,632 per benefit period. Coinsurance, $408 per day at days 61 to 90. Lifetime reserve days is 91 to 150, $816 per day. Skilled nursing coinsurance is $204 per day, 21 to 100 days per period. Under the Medicare Part B, the annual deductible is $240 per year. Coinsurance is 20% of the approved amount. Limited charges is 15% above the Medicare approved amount. And lastly, premiums come to $174.70 per year on a regular of an effective date and could be higher depending on the person's income for their premium. Additional government health plans are Medicaid. This is a health insurance program for low-income individuals and families who cannot afford health care coverage or cost. Primarily oversee is performed federally. Each state establishes eligibility standards, type of scope of services, rate of payment for services, and administer its own Medicare program. So you want to make sure that you check out the actual guidelines for each state because each state is different. Excuse me. Medicare required services include inpatient hospital, outpatient, prenatal care, vaccines for children, physician services, nursing facility services for persons aged 21 or older, family planning services and supplies, rural health clinic services, health care for persons eligible for skilled nursing services, laboratory x-rays, pediatric and family nurse practitioner services, nurse midwife services, federal qualified health centers, FQHC services and ambulatory services, early and periodic screenings, diagnostic and treatment, EPSTD, and services for children under 21. TRICARE. TRICARE is a healthcare benefit program for military personnel. Eligibility requires enrollment in the Defense Enrollment Eligibility Reporting System, DEERS. Some plans requires a PCP, some do not. Deductibles copays depend on the plan selected and the status of the patient. Coverage typically extended to the spouse and or unmarried children but have restrictions on age and military status at the time of care. Now, let's talk about consumer-driven health plans, CDHP. High deductible health plans plus reimbursement accounts. They're customized sub-capitation or healthcare reimbursement accounts, such as a flexible spending account, health savings account, and a healthcare reimbursement account could be included in this particular plans. Advantages of capitations. The benefits of capitations to a physician if care is managed correctly include decreased cost of bookkeeping as no statements need to be sent, no write-offs taken on accounts, etc. It decreases the time for billing staff as no claims exceptions, carve-out services are sent and no appeals are necessary, so billers may concentrate on other payers. Lastly, the physician does not have to wait for reimbursement. The disadvantage of capitation. It involves total acceptation of risk of the part of the physician. Patients must receive primary care from only one physician or physician group. Physicians may have to limit capitated patients seen to control costs. If one group has a large sick capitated population, they may make little or no profit or lose money. Specialists may be entered into capitation as they are risk for overutilization by primary care physicians. Software may be necessary for large groups to track utilization costs, perform risk, and calculations. Types of workers' comp coverage. Part 1. Workers' compensation insurance provides payments to employees who incurred work-related injuries or occupational illnesses. Part 2. Employer's liability insurance. It protects the employer against lawsuits due to the employment-related injuries or illnesses. Medical care, temporary disability benefits, permanent disability benefits, vocational rehabilitational services, and death benefits. The type of policy: homeowner insurance. No fault insurance pays for health care services a patient needs because of an injury that suffered on their property, regardless of who is at fault. Liability insurance protects against claims for negligence that causes someone to get injured. This includes medical payments to other coverage, which provides payment for necessary medical expenses for injured guests. No fault insurance or liability insurance would be the primary insurance in these cases instead of patients' own medical insurance. Physician credentialing is really important. Physician credentialing and PI requirements. A review of physicians complete education, training, residency, license, and any certifications in the physician specialty. CAQH maintains a universal provider data source and allows physicians to submit one credentialing application to multiple payers. So what happens is the provider becomes contracted with these particular insurances such as Cigna, Aetna, Medicare, Medicaid, and it's based off of their actual requirements, education, and training that they have completed to be able to supply these applications to each individual insurance plan. Aetna credentialing. Check background information, state licenses, American Board of Medical Specialties, schools and hospital programs, drug enforcement agencies, which is the DEA, controlled substance registration, contact Medicare, Medicaid to verify eligibility, look for disciplinary actions, malpractice claim history, hospital privileges, work history, employment background, credentialing, and performance committee. Aetna also gathers specific information including the provider's name and office location, provider's gender, specialty or specialties, patient age focus, the languages they speak, the hospital affiliations, medical group affiliations, board certification, and also office status for accepting new patients. NPI requirements, which stands for National Provider Identifier. This is a 10-digit identification number that is required for all healthcare providers that are covered under HIPAA. They are assigned this through what's called the MPPES, and it's an entity of the Center for Medicare and Medicaid Services, which is the CMS. And there are two types. The entity type 1 is a solo practitioner, which is an individual person. And then we have the entity 2, which is a group healthcare provider entity as well. NPI numbers. MPPS processes applications, assigns NPIs, and stores information about the provider and applies providers updates. NPIs can be applied for online, on paper, or through the third-party organization. NPIs are used on electronic HIPAA compliant transactions identified, including claim submission eligibility, claim status inquiry, referrals, and authorizations. NPI numbers are required to submit on a CMS 1500 form or a UB04 claim form to identify the provider. Utilization Review and Organizations, URO. This evaluates purpose hospital services for medical necessity, efficiency of services, facilities, and procedures. Work with other entities and work to contain healthcare costs by coordinating standards for insurance reimbursement, referrals, hospital admissions, office appointments, pre-authorizations and certifications, and monitoring of treatment plans. This concludes the end of our course. Thank you.